medical student colleagues as a whole regard general practice as a specialty?
You know the phrase, just a GP?
It's a nice lifestyle, it's sort of 9 to 5 job type thing.
I see a lot of people with coughs and colds. Quite boring, not a specialty. People come in and there's not a lot wrong with them.
Oh no.
There's a fair amount of negativity, at least that I experienced in preclinical medicine, about what a GP does. And when I got there, unsurprisingly, it wasn't like that at all.
The diversity and the range is just massive.
I was quite surprised by how busy the surgery was actually.
It's a really underestimated tough job. I mean, the sheer volume of patients that have to be seen.
You don't really know what's coming through the door, and it can be anything and you might not have heard of it.
And I think about the 10-minute consultation. Like, you have to be so skilled.
Is there anything that you loved about a Year 5 GP placement?
Only everything.
Yeah, I think I've really enjoyed in 5th year kind of becoming part of the team of the practice.
The doctors and the other staff in primary care have a lot more time for the students on the whole.
Oh my gosh, I use my stethoscope.
Patients value their GPs and the continued care that they get from GPs. They value it so much.
In many ways, general practice is like the closest to like the pure medicine you're being trained for.
I went into my GP placements fairly sure that I didn't want to be a GP, and came out the other side completely enamoured with it and wanting to be a GP.
I'm definitely considering GP.
So I think I've decided now that I do want to do GP training.
Even though I don't necessarily want to do it in the future, I think you'll always use things you've learned from GP in any hospital specialty.
It's a job that is easy to do on a mediocre or average level, but it is really hard to do really well. And when you do it really well, I mean, it's amazing.